All right, welcome to the Passion and Motion podcast. I'm your host, Mutsa, and today I'm joined by Eric Rodgers, and he is a male-centered therapist. So I'm excited to speak with him about just therapy, men's mental health, and all that good stuff. Hi, Eric. How's it going?
Hey, great. It's going great. Thank you for having me today.
Yeah, happy to have you here. A major reason why I decided to do this episode is because, June is known as Men's Mental Health Month.
Hmm.
So I thought, you know what? I think it'd be great to kind of also just have a conversation about men's mental health and everything around it. And yeah, just to have something where our brothers out there can listen to something and, gain something from it and just a space to kind of get some conversations going. So yeah, I'm excited to kind of get into that.
Yeah, me too. Excited. I'm thankful that places like this are starting to host these type conversations. So it's really nice to be here.
Yeah, no, 100%. So I guess, starting with that, like, what does Men's Mental Health Month actually mean to you since you're kind of in the space?
Yeah, for me, it means a lot. I've been working with men for about 6 years, and when I started off in this field, I worked with men who had like severe mental health issues, and to see just the lack of resources that many men have when it comes to mental health and how that is starting to change. This just makes this month so much more meaningful. It seems like it's having a huge impact on the transition in this field to really supporting men.
Yeah, I know there's also been a lot more conversations, again,
Mhm.
mainly around like the male loneliness epidemic. I think there's been a lot more conversations around that, even just like red pill culture and all these things that are like circling around because I don't know if there's been a time where it's been so hard. I mean, okay, I don't know, but this is a time where like things are really tough for the regular man out there, and yeah, so I think it's come at a
Mhm.
really good time that we really do need it. So, but we'll kind of get into that. So maybe also just starting off. So, what inspired you to get into men's mental health work?
Actually, it started with my internship, and I knew I wanted to be a counselor, but I wasn't at that time thinking I was going to focus on men. And my very first assignment was to the men's mental health unit with severe mental health on day one in my internship. So I'm
Wow.
working with men who have like schizophrenia and bipolar, and even those with maybe suicide ideations, very severe. And it was one of those moments I realized that, you know, with men, there's this perception of like danger if they're having a mental health crisis. They show it differently, between anger and all of these different pieces. And I just realized how they were treated, even in that setting,
Mm.
different than the female counterparts with similar challenges, and the amount of care that went into their placement and support services, and how many support services were available outside of addictions. There's not many male-centered services for mental health, especially severe mental health in that space.
Did that cut across all races, or did you also feel like it's in particular affects like black men more or white men more? Like, what was that like, the intersection
Yeah,
of race?
I definitely think there's a piece of that across all races. Now,
Okay.
granted, though, just due to economic statuses and of African Americans or Africans or blacks in different cultures, they uh, they have different resources that are available to them. And unfortunately, a lot of the families for, people of color just did not have the money to support the resources that they really needed. And so they had to rely on state funded. And they're not always the best, not always available to provide those services, especially here in Georgia in the United States where I'm at.
Yeah, no, that's so true. So throughout that, so how long was this internship for you?
This was about a year for this internship that
Okay.
I was there.
Nice. So in that year, so like how was that year for you? Like from the beginning towards the end, like what was that journey like? And then what did you kind of like do after that internship?
It was, I would say it was one of the most challenging experiences of my life because I this is the moment I realized when you go into mental health, you say you want to help people. But the one thing I didn't realize about the profession as a whole is that we are a profession that claims mental health, but we are uncomfortable with it.
Mm,
And that was the moment I was sitting next to someone who has schizophrenia. To me, that was somebody I just drove by on the street when they're having an episode as a homeless individual on the street. I didn't have to interact with them. I didn't have to support them and provide care, right? And I didn't even think about that even when I was going into mental health treatment. I was thinking about depression and sadness and things like that. And so for me, it was very hard because I had to get comfortable with mental health. And I realized, like, well, that makes sense being a mental health provider, but
yeah.
you're not really prepared for that.
No, I can imagine that. So, well, I guess I'm gonna ask before and after your internship. So, what drew you towards like wanting to be in the mental health space? Like, is that something you've always been fascinated by growing up? Like what was your relationship with mental health, therapy, and all these things prior to your internship?
Yeah. I think one is just like many therapists come to this field, you have your own personal experiences, right? I had
Yeah.
my own personal experiences with depression, anxiety, feeling like I don't fit in, feeling like I didn't have it all figured out early on. So I had some troubles, figuring out what to do with my life as a male. And
Mm,
then even having my own struggles with suicide ideations there for a moment in my own personal life. So that's one piece. And then the second piece is, as I was initially thought I was going to do coaching, and I did a huge training in executive coaching. And I realized as I was working even in that space, even with leaders and managers, they had mental health conditions and they were just trying to bypass it by going through coaching
mm,
because they didn't find people that really understood and can support them from their perspective.
mm. No, that makes a lot of sense. Yeah. And then, so what happened after your internship? Like, how did you progress into the space after
Yeah.
that experience?
After my internship, I continued to work with the hospital and I worked inpatient for a while working with that group because I really did enjoy working with them and I worked with some adolescents. And then I transitioned into outpatient services, providing more longer term care to those individuals. And then I went into addictions with adolescents and eventually went into doing a lot of advocacy work in the state to pass laws for professional counselors like myself to be able to provide more services. Because at the time we were limited into what we could do for individuals in need, which didn't make sense. If they're
Yeah.
in need and we're able to provide the service, clear us to provide it. And so we did a lot of work with that. And then after that, I eventually transitioned into starting Just for Men and hosting and having my own practice.
Oh no, yeah, that's cool. Yeah, so we're gonna talk about your own practice because I want to learn more about what exactly it is that you do and kind of everything around it. Um, but just like in your experience so far, how have like attitudes about men's mental health changed, as you've seen like over the years?
Changed over the years. Yeah, it has been fascinating. I will say there's been a huge shift in the way that especially younger generations perceive mental health. They are more open and more understanding that they have a problem that needs to be addressed.
Mm,
My older generation still struggles, but they are even starting to come around because I think as the world has changed around them or they're starting to reach retirement, especially retirement, right? Because that's the moment where you don't have work to kind of fill the space. You don't have kids. You don't have all the responsibilities anymore. And now is more front and center and it becomes more challenging to manage and deal with. You don't have all these escapes. And so you kind of see that. But I think as things are transitioning, men are starting to realize that their partners they're dating are demanding a more emotionally available man, right? And they're saying,
yeah.
like, how do I be that when I was never taught to be this for you? And women are saying, I don't want this distant individual who just here to pay the bills and take care of the family, right? They want a more emotionally available partner, or even if they're with another Male, they're still asking for their emotional availability, and that's becoming more and more challenging.
You know, it's fascinating that you bring that up because I have this conversation with my wife all the time about just like how society has changed. That, you know, back in the day, like 70s, 80s, even just like 10 years ago, you know, as a man, society just expected you to be the provider, right? The
Hmm.
jobs were there where you could just work a blue collar job, you could do whatever, but you could take care of the family. And well, back then women weren't really working. It was just like, okay, you're the homemaker. But now we're in a situation where a lot more women are getting educated, especially black women. I think they're the most educated demographic in the States right now, where
Yes,
like
they are.
they're really getting up, and high education too, right? They're like
Hmm.
elevating up.
Hmm.
But at the same time, men's education is dwindling down,
Hmm.
right? Like just the resources, the support, it's not the same for men as it is for women currently,
Hmm.
you know, and that's definitely affected just like how far a man can go. You know, we see less men in corporate jobs, we see less men high corporate jobs as well, and at the same time, the expectation is that you're still supposed to be that provider kind of guy, right?
Exactly. But what it means to be a provider is somewhat changing, right?
Yeah,
It's like, what are you providing now? And some women are like, I can pay my bills. I don't
exactly.
need your money, and I don't necessarily need you. So that means you have to provide something different. And men are struggling with that. And I'll also say, even with black men, I would say, just even thinking about our history and experience with mental health, I think that also has been a barrier because we learned from our fathers not to
Mm,
go for mental health treatment because they endured some really harsh treatments all the way, I mean, from slavery in the US and all the way up until different mental health studies that were conducted on black men. Schizophrenia was once, kind of considered the black man's disease for a moment there, especially when it kind of shifted to this idea and aggression and anger. And, you had all these different experiences where mental health treatment or just medical treatment generally was not considered safe, and nor did you get fair treatment uh, in that space. So a lot of times for black culture, it was, you stay away from certain things because it was
yeah.
dangerous. You know?
No, 100%. And I'm even thinking back to my African background because back home, like in Zimbabwe specifically, and I'm sure it's in other cultures, some mental health issues are labeled as, oh, witchcraft, or
Hmm.
oh, this person is, you know, we don't associate with this person because, oh, something's wrong with you. And nah, we
Hmm.
don't even, around suicide, for example. So in our culture back home, like if somebody does commit suicide, even the way they're buried is different.
Hmm.
You can't go to their funeral. A lot of people can't go to they say you can't cry for them because I think it's a way to kind of like not to kind of disincentivize people from doing it because it's like your family can't mourn you. It's gonna be you're gonna be buried differently. Like the whole other set of practices where it's like very kind of detached, you know, just
Yes.
because of like that stigma would say, okay, this person committed suicide, so we're never gonna come in your house type situation. We're not gonna cry for you the same way. Just so like, oh, people shouldn't do it, that kind of thing. But
Hmm.
it, there's still that stigma around it. I don't know if you've come across different stigmas around such things like this.
Yeah, and I've heard from similar cultures, very similar treatment, and it is unfortunate. And then that sort of gets passed down because now I don't want to be perceived as someone who has these challenges, and I'm not going to reach out for help. And then the guilt of all that and the burden of all that, then if it's hopeless here and it's going to be hopeless there, then what option do I feel like I have?
Yeah.
It doesn't matter anywhere, then I might as well take it. And that's what sometimes they say. It just doesn't matter anyway.
No, that's true. So like I guess in your experience as well now, like what challenges do you see about men's mental health? Like when it comes to opening up about the things that they're struggling with.
Yeah. One, I think being a few things here with men's mental health. One, our feel again, remember I said we're not comfortable with mental health. And one of the things about having suicide ideations is, especially here in the States, if you have a suicide ideation, it's very strong. No one is going to see you.
Mm.
No one is going to take you on as a client because they're so worried about liability. And therefore, the only treatment you can get typically is to be hospitalized. And a psychiatric hospital, but then you're placed in a unit with those who may have schizophrenia, bipolar, and that becomes scary experience for you, while you're kind of trying to deal with your, struggles with suicide. And then when you come out, they say, hey, let's get you some help. But then no one wants to work with you. So then where do you even go to get that type of treatment, right? So that's one piece of the problem. And if you look on Psychology of the Day, very few people will put suicide as a area that they work with you in. You look in, you'll see that. The
Interesting.
the other piece though that I think is a barrier for men coming in is that men actually just naturally, just biologically, we kind of develop natural processes that don't allow us to communicate emotions. Whether that's from the cultural piece just kind of exacerbates it, kind of makes it worse over time. But that's kind of a natural inherent tendency. We don't really connect with emotions, and that's something we have to be kind of taught and learn. And we don't realize that even through the way we play. Playing family, with girls and where they do, is all about emotions. They're learning
Mm.
it young, right? We're playing race cars and different things like that, but we're not having dialogues or conversations. And what was interesting, sometimes you would see a slight difference in the clients I worked with who actually had anime as a part of their life. They actually sometimes do a little bit better in my experience with emotions versus those that didn't because they got to see those type dialogues.
That is so fascinating. Anime. I didn't know that there was a connection between how you process your emotions and watching anime. I'm a big Naruto fan, so Naruto is very, very emotional. Like there have been moments where I'm watching. Do you watch Naruto?
Yes, I watch
Yeah,
Naruto.
yeah, yeah. There've been moments where like they have really, really, really intense conversations or really, really
Mhm.
intense scenes, and even I'm brought to like, man, I could cry right here. And it's just
Hey,
like, and some people like, bro, you're getting emotional over a cartoon, and it's like, listen, it's not that simple.
it's
Yeah.
not. Mhm. Right. But think about outside of that, where do you actually see as a male that type of friendship and bond and connection really presented in what you watch?
Mm. Let me actually think about that. I don't know. I think maybe I'm trying to think because there's the series is it Girlfriends where it's all about female
Hmm.
friendships, right? But I'm trying to
Hmm.
think, was there a show about male friendships, like a black male friendship sitcom
Hmm.
that just
They're very
focused on,
rare.
yeah,
Very,
I'm even thinking, is there one of those?
no, I'm not aware that I can think of off, the top of my head. And again, they're gonna be very rare. And do they go as deep and as vulnerable as something as a Naruto? Like that's some vulnerability there, right?
Yeah.
That you don't really see.
That is so fascinating. Yeah, I had no idea. When we're talking about you saying that people who have the suicidal ideation don't get as much support. What about when they call the hotline? I don't like. I thought there would be like a procedure where like if you do call I don't remember what the number is, but if you do call that number, they support supposed to you're supposed to get some support, but I don't know what that support is. I'm not too sure. So what happens if you call the
Yeah, so
hotline?
you'll call the hotline. The hotlines are great. I mean, what they do on a day-to-day basis, I really commend the training they get. And they provide great service. But just keep that's the in the moment service. And
Mm,
yes, they will attempt to connect you with resources, but a lot of times they're going to connect you with state resources, or they may connect you for an evaluation to be hospitalized. They don't really have a lot of resources to connect you for a therapist who's going to meet with you 2 or 3 times a week and work with you on that challenge that's leading you to be suicidal, right? To leading you to develop that feeling, because most of them, again, are going to say you're too high risk.
mm. I don't even know, but why is it that there is that high risk? Because I would have thought that you know, the liability of saying, okay, if you're a therapist and you work with someone, so let me actually try to understand here. So how does it work? So let's say somebody has that suicidal ideation, they meet with the therapist and they end up, committing or whatever. D that blows back on the therapist, or what exactly is the liability here that might force or that might uh not make somebody want to work with somebody who's got that ideation? Like what exactly happens?
It's a few things. One, I think from the therapist standpoint, I think it's just a lack of training, lack of information and certainty around that. So, for instance, To kind of give you an example, like in Georgia, we don't have a law in the books with duty to warn or duty to protect, right? That's very clear. We have a case law and then we have a rule, but they kind of conflict with each other. And there's nothing in this law that says if I break your confidentiality, let's and step away from suicide for a moment. Let's say you can come to me with homicidal ideation. I want to go hurt somebody. If I report that to the police to say you're going to hurt somebody, there's nothing in the law that says I am protected for breaking confidentiality, which I'm supposed to keep. And then I could be potentially sued by the client because I broke the confidentiality. Yet on the rules, it says I should. Then the law says maybe I shouldn't. And so it gets confusing, right?
Oh.
Then, I mean, the case law says I shouldn't. Then you think about suicide, though it is one, it depends on the incident, how it works. That opens you up for scrutiny. Are your notes going to be requested? Do you have to show documentation to different organizations or attorneys? That gets very scary. And then maybe I'm not fully comfortable with documenting those type cases. And guess what? 90% of us out here in this field, probably 95% of us, never had an experience where we actually got an opportunity to work and train to work with that population. And now I got to have this high risk person come to my office, but there's nobody to support me. Who do I call to get consultation with on that type client that works with them in that space outside of like a psychiatrist or a medical doctor, which they have a different liability insurance for them.
Wow, I didn't even know that there was such an issue when it comes to this, like just kind of the help that can come for that particular problem.
Mhm.
What do you think would be the solution to this, if anything?
Yeah, I think it's more training, right? I
Mm,
think it is getting us comfortable with navigating. We're not attorneys.
yeah.
So the idea that somebody's going to request our records and go through this, and we may have to be in court, and especially it has to be investigated, police may ask questions, that's scary. And we need more trainings that kind of simplify this, really give us real numbers. And in all honesty, I work in a different position because I work for also the association of the state. So I get to see a lot of court cases and stuff. And in reality, a lot of people have clients commit suicide, even if they weren't there for suicide, and they rarely ever become an issue. But because we think it can become an issue, we are fearful because no one is really helping us understand it. So we need more mental health attorneys who actually can train in that space because I can't go out here and tell you legally what your liability may be or how to navigate. I can talk about ethics, but we need more mental health attorneys to really guide people in that space and more clinicians to talk about their experiences and how they navigated it.
And this is across all the states.
Yeah, this is pretty much normal. All right. There are some states that have better laws and protection around, duty report and stuff like that for sure. But generally, working with someone who is suicidal is considered high risk. And if you look at like one of the well-known trainings is like CAMS, which you can go get this training and you're like CAMS trained for suicide interventions. And if you look there, this is like one of the top ones in the country. And you look, I think last time I checked, there's only me and maybe one or two other people in the whole state of Georgia that has that credential to even work with that population, right?
Wow.
Um, and that's minimum across the state. So while they are training a lot of people, but when you think in the grand scheme, it's very minimal.
That is wow. That's actually so crazy that they don't. Is suicide ideation the only one that's considered high risk? Or I think you also mentioned homicidal. How many are the high risk ones
Yeah,
like
so it's
that?
like suicidal, right?
Hmm.
Homicidal, but even the ones that are more controversial, right? In the sense of morality. Let's say if I do have thoughts of, you know, pedophilia and I don't want to do it, I can't
Mm,
go get help for that because no one wants to take that on because again, that becomes high risk to help someone before they engage in it. Because if they do, while they're in your care, then that again opens you up into investigation. Or you may have to submit documentation, show what you were doing, right? And it becomes scary. But here someone is like, I don't like it. I don't want to have this. I want to get help. but then there's nowhere really to go for that.
Wow. So the easy fix is just to send these people to like a hospital. Is that
Some of
usually
them.
what it
Now that
is?
that last case, they're not hospital. You can't go to the hospital. That's not something that you can be hospitalized for, right? That is not a high risk in the sense of your life per se.
Hmm.
But the other two, yeah, it's pretty much just the hospital.
And then in these hospitals, so my brother is also like training to be a social worker, and he's like working in hospitals where he deals with people dealing with mental health issues and stuff like that. I've heard kind of we've kind of talked about it, like kind of some of the things that be happening around there. But in your experience, so what happens though? Like if you are sent to these hospitals, is there somebody there who's actually trained to kind of take care of that, or are they just kind of put in a room and hey, we're just gonna strap you up and we hope for the best. Like, what exactly happens in there?
It depends. I would say it's hit or miss.
Hmm.
I would say, from my experience, and I won't put names out there, but I would say in my experience, I have had better experience when the psychiatric hospital was nonprofit
Hmm.
versus for-profit hospitals. And to give you an example of kind of what I experienced, right? So I remember the one night I was working in one of the hospitals, and I am the only clinician there. But at this time, not the only clinician, sorry, I'm one of like five clinicians there. And at the time, I had an associate license, which is like you're in training license or residency, type license. And a client came in who had to be 1013. Like that client walked in the door, got assessed, and we needed somebody to 1013 them. And that's basically in Georgia, that means to involuntarily hospitalize them.
Okay.
Okay. Because they were a danger to themselves. In that psychiatric hospital, there was not a single person in the building with a higher license than me. And I was in training. Everybody else had absolutely no license. So therefore, they hire a lot of time. This is just my experience here in Georgia. I can't speak across and what I've seen across the U.S. I don't know across the world.
Yeah.
But what they do is they tend to hire those who are no license or associate level, don't really provide a lot of supervision, training, and depth because it's about meeting the standards versus providing optimum care to the client. Did I meet the minimal requirements? And so you hear a lot of clients complain about the quality of care because this individual may not just be trained to deal with that. And two, if I is usually group therapy, which is the type of therapy you receive there. And there are some good cases where people come out. But think about it. In like my group, I had a client with schizophrenia, client with schizoaffective, client with bipolar, a client who was suicidal, client with severe depression, all in one group. And I'm trying to create a topic or discussion that everybody can participate in, but they're all at different levels.
Hmm.
And that's very difficult, especially for a new clinician.
That is so hard. Yeah, that's actually kind of man, because it's not the same thing as like if you go to an Alcoholics Anonymous where like you're all basically dealing with the same kind of problem,
Right.
right? It's
Mhm.
like different things and also varying degrees of what that is. That must be really tough to be able to just navigate something like that.
It is very tough, plus the workload, right? Because
Mm.
the not only do you got to do the groups, you got to do two groups a day. Plus, I got to do the discharge paperwork for every client. I got to make sure they got placement, place to go. I got to call and do a family session for every single client on my load. I got to have an individual session. I got to meet with them and do their initial assessment. I got to call family and make sure they got a house, insurance, all of these different things. I don't have time to learn my client and how to intervene and set up a great group session to really work with them. Because when I finish, and I remember even as an intern, if I had a 5 minute delay, took an extra sip of coffee, I'm there at work for extra 30, 40 minutes because that's just how tight it was. You're running from start to finish to get that intense amount of work done. And it is not always easy for those type clients because if they don't have housing and they don't have money and we can't send them to a shelter, which I don't think they should be forced to go to a shelter, that's a lot of time and energy trying to find them a place.
Mm. And that's
What
hard
that
in
looks
general.
like. Yeah.
Yeah, that's already like a very difficult thing to do in general, just trying to find a place. So with this extenuating, yeah, man. So is there like, before we kind of move on, is there like a lot of burnout then that a lot of
That's
y'all
burnt
face when it
out.
comes to this?
I was burnt out by the end of my internship. I took literally part-time work for a while before I went back into full-time work, just from the internship alone.
Wow. So like now, how do you kind of manage that?
Now it's not so bad, and I don't do hospital work anymore.
Mm,
But it's not as bad because I have a lot more flexibility and I balance it out, and it's different, right? In private practice, is different. I kind of determine my workload. But in those settings, when you really want to work with those in need, there's just not many resources there.
wow. Yeah, I didn't, you know what, this has opened up a whole other angle that I had no idea about, but thank you for bringing this to light because you don't really know what's missing, or you don't really know like the level of what something is at. Like there could always be way more support, when it comes to some of these services, and you just never really hear about it, which is a privilege because if I've never had to deal with that, I wouldn't know, but the millions of people out there who do, and I can't imagine how difficult it must be to kind of like go through a system that first of all seems understaffed, people are burnt out, and it just sounds like it's a lot to kind of even manage. So
Hmm.
yeah, I had no idea that it was to this degree, to be
Oh
honest.
yes, yeah, yes, it's very challenging.
Yeah. So okay, so just kind of moving on then, like, what are some of the like common mental health issues that you kind of see with men?
And then, yeah,
Yeah.
generally on the general side, a lot of men are dealing with uh, uh, irritability or anger that sometimes is legit, but sometimes it's a mask for their own insecurities or depression or things like that. So you'll see that. A lot of relationship issues I get because, again, as we talked about earlier, men are struggling to figure out how to connect with their partners that are demanding things of them that is very different than their fathers were had demanded of them.
Yeah.
And so that's one piece. ADHD, if you're working with men, you're going to deal with a lot of ADHD, and especially undiagnosed and adult men coming in I'm struggling at work. I have irritability. Sometimes I think I'm hearing voices, but then they don't really know. But it's really just they're overthinking so heavily, it gives them the impression that they're having psychosis. They're hearing voices, right? Um, they are very, you know, um, I can't think of the word I want to use right now. Impulsive, right? So impulsive. So then they have a lot of issues with like friends or crossing boundaries and saying things that people may find like not nice, or hey, read the room type thing, right?
Yeah.
And that's usually sometimes you can see that with ADHD. Or so I see that a lot with men. And more recently, surprisingly, a little bit of adult autism coming in, not a whole lot, but I'm starting to see that more as they are trying to navigate the world. Social anxiety is typical with men. Now, what most people think I work with, which is interesting, most people think I work with a lot of narcissistic personalities or antisocial, right?
Yeah.
And first time I say, for men, and this is for all the men out there listening to me, most likely, almost 99% of you are not narcissistic. No matter how many people say you are probably not. Okay. It only impacts less than 1% of the population. And I think that's even a global number there. What we're really saying is sometimes, just based on cultural norms or the way we're raised, sometimes men just may do things that's kind of buttholish, it's like it's not really a good act, but they're not narcissistic. And if you ever meet someone who truly is, and it's a very different experience than the ones that we sometimes claim are. But men are coming in because somebody told them that, and they're impacted from that, and then they're just realizing, no, you're depressed or you have ADHD, right? And it's just coming off this way.
You just made me think of something. So, in this day and age, it's become very, very easy to kind of use buzzwords
Yeah.
and just throw them around a little flippantly, right? Like, oh, you're a
Hmm.
narcissist. Oh,
Hmm.
you are a love bomber. Oh, you are selfish. I mean, okay,
Hmm.
and these are things that are like said like so easily. Like you might show something that could be a narcissistic behavior, but that
Correct.
doesn't necessarily mean you're a narcissist. And
Exactly.
so I think I wonder if that, like, how much of that is contributing to it too, like in this day and age where, like, a lot more people are just throwing words around. Because the thing with therapy as well is I know it wasn't widely accepted or used for a long time beforehand, like, especially for men. But now we have a lot more men that do go to therapy and a lot more people that
Hmm.
do go to therapy. And, now people have kind of learned some of the words, like therapy words and some of
Hmm.
these diagnoses and whatever, right? And now it's more like mainstream to kind of just say something like, you know what? Out therapy, that's what that looks like. I think that's what you have when it's really not. Like, you know.
Yeah. When it's not, right? And also it could be so many things, even if it is, let's another buzzword, and even for men it's a buzzword, it's trauma. And while trauma is real and a lot of people do experience trauma, and I think there is a lot to be done in that space, but it has become so, commercialized now that everybody walks in the door, they're like, I got some type of trauma. I got some type
Mm.
of trauma, right? And yeah, you can have a bad experience, but it doesn't necessarily make it trauma. And that is also showing its ugly head right now.
No, 100%. So just to also put it out there, you said only like maybe 1% of people are actually true narcissists. Can you
Yeah.
just kind of describe what a true narcissist is in your opinion?
Yeah. So you will see a bit more grandiosity, like grandiose, like the world really is about them. It centers around them. And even when I'm being nice or kind to you, it is literally to feed my ego. Right? It is usually sometimes they can have that kind of antisocial piece in there where they don't really truly care about you. But when it's true narcissism, it is to the extreme. It is going to be some very painful moments. They are going to be very manipulative. They can be very charming when they want to, and then flip that script on you to become something very different at any
Mm,
given time. But just generally, though, in the sense of I might have an area of my life where I might do some of those type behaviors. Um, that is in itself is not necessarily narcissism, right? Narcissism is gonna flow through. So when we think about narcissism, it's a personality disorder. That means that's gonna flow through primarily every area of their life, from mom to dad to uncle to you to auntie. Everybody is somewhat of a pawn in their scheme, versus some other people, right? You be like, but you don't do your mom like that, or you don't do your sister like that, right? That's not narcissism because they're demonstrating they have the ability to do this and they do care. That narcissism would be kind of across the board. It's an enduring personality.
mm. Yeah, so you know what, listener, if you're listening to this, you are most likely not a narcissist. So that's what this is all about. You're most likely not a narcissist.
Narcissist.
Um, you know what?
I was just gonna add this, and then two. Sometimes it's just someone wasn't raised with boundaries, and now they don't understand boundaries, and now they've been used to getting everything they want, and they can look like they're narcissistic, but in reality, the world has always given them what they want. They've been trained that the world should give them what they want, and now they're acting that way. But that's very different too.
That's definitely a big one. If you just
Hmm.
grew up, especially like if you grew up privileged or whatever, and your parents
Hmm.
just give you whatever you want, and you think, hey, I deserve whatever. If I want it, I get it. And there's no, like, the word no isn't used as much anymore. You know. Wow. Yeah. Okay. So also just shifting gears a little bit here. I want to talk as well about just like the male loneliness epidemic that we kind of see out there. We kind of already alluded to it a little bit, and just how, you know, especially even when it comes to like relationships and stuff like that.
Hmm.
what role do you see that friendships and community play in men's mental health? Because, I was watching Josh Johnson's YouTube stand-up thing that he does usually, and he actually was speaking about this, and like, we have millions of men who claim that they're lonely. It's as simple as, well, if there's someone out there that's lonely and you're lonely, you should be able to link up, right? And
But how do I find a lonely person?
but how do you, yeah, exactly, things like that, right? So what do you say to that? Like, just what are your thoughts on just like the male loneliness epidemic today and right now, and just like the things that men are, you know, coming into themselves and just thinking that, hey, like I'm never gonna find genuine connections, whether it be romantic, platonic, stuff like that, and then just kind of spend all their time on social
Yeah.
media, hating the world and stuff like that.
Loneliness is it seems simple, but it's a very complex issue to me. And it's not everybody walks in with the same reason for it, right? I would say one of the things you see with loneliness is one, if you are somebody who ruminates a lot and you're always in your head and you're thinking about, and they feel like they're on this journey of deep philosophical insight. And essentially, what they don't realize, they're coming in, they say, "Hey, I'm lonely." But then I say, "Well, you were just out with a group of friends." Yeah, but I did not connect with them. And I'll ask them, I was like, "Hey, so while you was with them, did you feel this intense desire to just get home so that you can go lay on your sofa and think about all the ways you are somewhat struggling in this life and can't connect and you are struggling, right?" And they're like, "Yes, I just want to get home because I feel like I can figure it out." And they don't realize they become somewhat addicted to that rumination and that thinking, and it's disconnecting them from the people around them because they're looking for this deep philosophical answer that's just unfortunately is never going to be there. And then you have to help them disconnect from that. Two, it can be something as simple as we say we want a connection, we want to experience the world, but then when I'm working with men, they think it's a magic feeling. I should feel connected. And that means that you're waiting for this magic moment versus saying, how do I engage people and actually interact with them and understand that they care, look for the emotions and what they're doing. And if I don't feel it over time, once I recognize it, then the feelings will come. So, but again, if we haven't been taught to emotionally connect with people, for us, we're just hanging out and we're not even picking up the signs that somebody really cares. Someone is handing us handouts. They're asking us to hang out, right? So
Yeah.
you have that, and they have these kind of predefined definitions of what curing loneliness should be. It should be I have the perfect woman. It should be I have the perfect friend. It should be everybody see me a certain way. Then I'm not lonely. And you have that. So all of those things come in and contribute. And then if it's anxiety, then it's I'm avoiding what makes me uncomfortable because that becomes a safety behavior. But yet at the same time, I'm saying I'm lonely. Nobody wants to be around me, But you're gonna avoid them at all costs. You're gonna do everything in your power to avoid them. So
Yeah.
it is, and I do think also though with men, as much as we are getting, with social media and stuff like that, we have created these narratives that I see a lot of them come in with of what their world should be, and when it's not, that makes them feel like they're disconnected. And what they do is they start window shopping at other men and saying, see, looking at this Instagram post, see, they're living this way. They're having a great life. And therefore, that's why they're not lonely and I am.
Mm.
And it becomes this kind of comparison piece. But
I've
it is.
seen, yeah, I've seen a lot of it also becomes a self-fulfilling prophecy, right?
Exactly.
Like you be like, hey, I don't feel like I connect with people, but then when you're with people, you're disconnecting with the same people you're with, and then you go back home, like, you see, I'm not connecting with people anymore, and like it's just that thing, and then it just keeps building and building and building and building, and then you're just not able to connect anymore because you've kind of done
Uh-huh.
that to
You know
yourself
that.
as well.
And you're not giving things credit, right? They'll say they didn't do this one thing. Then I say, but what about all of these other 10 things? Well, I didn't even pay that any attention. Like I didn't even think about all that because I've been looking for this one thing, and it makes them disconnect.
Yeah. No, that's so true because I mean, again, there was a whole TikTok trend. I don't know if you saw it about like men calling their friends to say goodnight. And the reactions to that were like, because for some men it's like, bro, why are you calling me to say goodnight? Which is just a
Hmm.
simple thing, right? Because I think, women do have a lot of those connections where they can call their friends to talk, they can say I love you and all these things. But for men, it's a little more difficult to express you know, that emotional side with your homies. I think maybe like you have one close friend that maybe you say that to, or two close friends that you say that to, but that's really about it. And if you don't have that, then it can be quite challenging. But I also want to have this conversation. Since it is men's mental health month, I also want to talk about some of the positive things that men can do if they do feel some way, or if they feel like, okay, you're dealing with loneliness, you're dealing with some of these issues. What are some things that men can do this month to feel more connected, to feel less pressure, to feel, I don't know, just better about themselves? Like, what would you say about that?
Yeah, I think one is for a lot of men, part of the disconnect is they don't understand truly what they're feeling. And when they're telling someone, they're like, "Hey, what's wrong with you? I just don't feel good. I don't feel like me. I'm not happy, right?" But the person really don't truly understand what that means and what you're really feeling. So one thing I would say for men is, if anything, start practicing labeling your emotions so that you can really tell people what you feel. And you can download like a free feelings wheel online and just start to figure out like, oh, that's what I'm truly feeling. And now I can tell someone that's the space I'm in. And then they can better help and communicate with me, right? One, I would say for men too is do not underestimate the power of movement. Getting out, exercising, going to the gym, joining walk hiking clubs and walking with other people. All of these different things will be very helpful. It helps with depression, anxiety, and that feeling of loneliness a lot because you're not just sitting. The more you're sitting and just kind of letting your body stay in that state, the the more powerful those feelings unfortunately become. Uh, Routines are good. Set up good routines. The one thing I'd say for a lot of men who are lonely, I'd be like, okay, so how did you plan to get out of loneliness? I mean, well, they're like, well, I just thought it was gonna happen. Somebody's just gonna wake up and be my friend, you know. So I was like, hey, go ahead and put it in your calendar. Plan things to do that involves other people. Use Meetup, get out and do those different things. But I would say most importantly, though, asking for help doesn't necessarily require the person on the other end to fully understand or to accept. You are just getting used to communicating so that when you do find that person who understands, you are ready and they are ready to receive it, that message from you. But those are some of the things I would say. Of course, you can get into yoga, mindfulness, and all that stuff. But generally, for most men, I think it is just practice, plan, practice, and execute,
Mm.
and stick with that.
Yeah. And then just to follow up to that, so what can men do for each other? Like, what do you believe men should be doing more for one another?
Yeah, I think one is practice having deeper conversation with each other. Say, talk about emotional struggles that you see in the world and things like that, right? Talk about it, not just simply saying, oh, that's bad or that's messed up. Really talk about it and give it some depth, right? Have some conversation. What does it mean? And I think as men, if we mirror, especially older men, we mirror what it looks like to be vulnerable and to talk, then the space around us becomes less toxic and we feel more comfortable. And hopefully on time, my self stigma, because there's a external stigma, right? So I want to feel comfortable around my peers. That's step one that most men can give to each other. But as I get more comfortable with you, then maybe my internal stigma will eventually catch up and feel more comfortable as well.
Hmm. Yeah, no, that's true. And I think also men should just check up on each other a lot more.
Hmm.
Call your friends. Hit up your, like, hey, let me just, I haven't spoken to you in a minute. How are you
And that's
doing?
it. Exactly. And that's what I mean by demonstrating the behavior. If you demonstrate it, then someone else can feel comfortable with it. But
Mm.
you may have to do it a few times. But the problem is a lot of times men start doing it and they like, but nobody doing it back, and they get frustrated. I was like, but you got to give them time. They spent their whole life not doing what you are demonstrating to them, so they're gonna need more than a couple of weeks to adjust.
Mm.
Stick with it though. They
So
do appreciate it.
yeah, so maybe the message is like, so be more patient with one another
Be more patient.
when it comes to this.
Hmm.
Yeah, no, because I think it was just a TikTok thing, but I thought it was really important that you call your homie and say, hey, I just want to say good night, man. You know, I just want to say, or good morning, like, hey, just want to say good morning, have a great day, buddy. Things like that. Even yeah, you might not necessarily have to have a full blown conversation, but even just that checking in on one another is, I think, very important to do.
Very important. And ask about things you never asked about before. You always ask about the football game. That's great. Ask about their goals. Ask about their life. Ask about how they interacting with the family. Ask how they feel with the kids. Ask about the things you never asked before.
Yeah, yeah. And final question before we wrap up.
Mhm.
You just brought up kids. What fathers of today, what can they do to make sure that they're raising boys that are in tune with
Mm.
their emotions and in tune with knowing, like, okay, I don't have to keep it in. It's okay to just
Mhm.
be fine with that. Yeah.
Yeah, that's a challenge for a lot of men. I think the very first thing is young boys are usually more attuned to emotions. They are conditioned over time to kind of leave that space.
Yeah.
And so they are crying out for dads to tell them how they feel. They want to hear how their dad feels. They want to hear their dad loves them and not just say, I love you. No, they want to hear it, right? So I think for dads, it's just practice being vulnerable with your kids. Tell them all the things you will want them to know and tell them. Don't write it, letters okay, but get used to telling them because they're like that distance is very disheartening to them at a young age when dad doesn't show excitement about everything that they're interested in. Dad only shows excitement when it's sports. Show up at the school, not just mom when there's an issue at the school. Pick them up sometimes, not just mom. Take them to the doctor's office, not just mom. Be active in the process of their life more so than only your interest is what I see a lot of fathers do. And it's not about, and be very careful with this idea, especially with blacks, is, I try to protect them from things.
Mm,
That that just creates walls and barriers and you just look closed off to them.
mm. Yeah, because the funny, well, not it's funny but not funny, but the only time some kids only see their dads express emotion is during a sport. Oh, my team won, and dad's gonna be extremely happy today.
Uh-huh.
The team lost. Oh man, I know he's gonna be in his feelings.
Uh-huh.
And that's usually the only time sometimes where children only get to see their fathers express deep happiness, and
Exactly.
it should be more than that.
Should be more. Show that same happiness when they do the little macaroni art. Show that same happiness for that because they want to see it there too.
Yeah, no, 100%. There's definitely a lot more that we could have chatted about, but I think this was a good intro to at least having some of these conversations, or at least bringing them up. And if you listen to this podcast, have if there's a particular part that we chatted about that you feel like you want to dive more into, call your friend, have that chat. Just be like, yo, you know what? I've never thought about this, or I've been thinking about this. And if you're feeling whatever you're feeling and you need somebody to just chat to, it can be really like as simple as just picking up your phone, because sometimes there's that mental block, like, man, if I call this person, they even pick up. But try, you know?
Right. Right.
Yeah, just any parting words from you just to men out there in general during this month before we close out?
Yeah, I would just say to all men out there, one, I would say it's okay to share your emotions, to share your feelings, and it's okay to not even know what you're feeling. It's okay to not even understand it, and it's okay to ask for help. And if you need resources, feel free to reach out to me. I'll provide resources no matter where you are. I'll try to connect you to whatever you need, but just know men are out here to help other men.
Yeah, actually, so if someone's listening to this and they say, hey, you know, I really want to chat to you specifically, how can they get in contact with you? Because I know you have your organization,
Mhm.
Just Men Behavioral Health, right?
Yeah.
So
So
there's,
it's
yeah.
just just for men behavioral health. So it's just for FOR men, B as in boy, H as in health.com. You go there, send me a message. Me or my staff, we will definitely reply to you and get you any service or connect you. Always here to provide a helping hand whenever I can. And then it's not about the money for that piece. So it is literally about getting you to where you need to be. So don't feel afraid to reach out.
Yeah, no, I love that, and I'll also link your stuff like in the obviously on the video once it's done, and even where I posted on the socials and things like that.
Okay.
So I'll also just have that there so that if anyone's like, hey, I really wanna, he seems like someone who I could actually have a
Yeah.
conversation with. Yeah, I'll link that. But Eric, thank you so much for coming on the podcast and chatting
Thank
it
you for
up,
having me.
and just I think these conversations need to happen more often for sure. So I'm
Yes.
happy that we at least got an opportunity to do that.
Yes. Awesome. Thank you.
Yeah. All right, listener, thank you so much for hanging out with us. And yeah, do comment actually if there are things in this conversation that you liked. Please do share your comments. I'd love to see them. I'm sure Eric would love to see them too, you know.
Sure.
Like do let us know in the comments and all that good stuff. Share with your friends as well this episode and all that good stuff. So with that, thank you so much and we will catch you on the next episode. Peace out.